So the Kazakh Health Program gives a very good long-term vision for the Kazakh health system development, and WHO is fully behind this. It is a very important development plan, and it will lead to very good health outcomes and also to improved health system performance. The health outcomes, the health status indicators in Kazakhstan have already improved during the last few years. Life expectancy has increased, maternal and child mortality have decreased, and the health and the well-being of mothers and children have continued to increase. And the joint project of the European Union and WHO in 3 districts have contributed greatly to this, and therefore it is quite important that we roll out these projects to the rest of the country as well. In the field of infectious diseases, Kazakhstan is doing very well in many aspects of the work. Malaria is going into the very right direction. The polio outbreak last year was brought under full control by the effective leadership and support of Her Excellency the Minister of Health. There is a high level of childhood immunization program in the country, reaching nearly 100% of the children, and this is extremely important, and it can be regarded as a model, as a good case study also for other parts and other countries of the European region. In the area of chronic non-communicable diseases, there are problems everywhere in the world. Also in Kazakhstan, this leads to mortality and morbidity, and therefore we need a very active integrated action plan to combat this. And now that we have the European action plan, we have to translate it also into a national action plan for Kazakhstan. But you have done lots of good things also in this area, like in the field of tobacco, to implement the measures of the FCTC, the Framework Convention of Tobacco, and also led by His Excellency the President and supported by the Minister of Health. New pictorial warnings have been introduced in the country, which also leads the way for other countries in the region. I am also pleased to note that the alcohol consumption, especially among the young generations, is not as big a problem as it is in the other parts of the European region, and this all gives us the hope that the NCDs will be brought under control in the coming years. We also have to address the social determinants, the poverty issues in relation to NCDs, and this requires a multi-sectoral approach, an intersectoral approach, and also to go down to the root causes. And of course this means that a very strong political commitment from the President and from his office will continue to be needed also in the years to come. But it is extremely reassuring for me as WHO Regional Director to see the strong commitment and political leadership of the President himself in health and social well-being issues. With regard to the health system strengthening, the policy and the strategic plan is in place, and this has to continue. It will take time, and we have to be patient until it will lead to the results as we all expect it to be. And we have to focus our attention on primary health care, on integrated care, and on training, on education, on capacity building. And also in many ways we need to change the culture in the healthcare system, which will take time, and it will not happen from one day to the other. But my important message on this is that WHO is fully behind the government of Kazakhstan, the Minister of Health of Kazakhstan, who is taking real leadership on this, and we will continue to support him in the years to come until this plan is fully implemented. On the WHO and Kazakh collaboration, this collaboration has been in place during the last 20 years since the independence of Kazakhstan. We have WHO office here ever since the country became independent, but during the last 1 or 2 years we started to scale up the activities in our collaboration once again, and we strengthened the country WHO country office here with an excellent leader, and we provide all the support also from the regional office. Our priorities in the first years mainly concentrated on infectious diseases like tuberculosis, like HIV/AIDS, like malaria, like polio elimination, like immunization programs, and some of these will have to continue, like the TB and HIV, whereas, as I said, malaria and poliomyelitis and immunization, the country is making excellent progress, and it can be regarded also as a good model for the other countries and the neighboring countries. In the area of NCDs, it was not among our priorities in the past years, but now we have to put it into the priorities, and I am pleased to note that in the new collaborative agreement that we are going to sign with Her Excellency Minister of Health, Madam Bekova, it is among the list of priorities, and we need to move and further develop the action plans. And the third area in our collaboration, which has to be scaled up, is the health system strengthening, where within the health systems we have to focus our attention on primary health care, on integrated care, integrate the vertical programs into the integrated health system approach. We have to put more attention on the public health related issues so that we can prevent as many diseases as possible. We can promote the health of the individuals and protect the health so that they do not have to end up in the healthcare system to put additional burden on the healthcare system, and we have to continue to support the country on health financing issues, and here the spirit of solidarity and equal access and equal opportunity for all is the WHO approved agenda. So these will continue to be our priorities, and we are looking forward to work with Kazakhstan in the years to come, and I look forward to Kazakhstan also to lead many of the developments in the Central Asian countries.